Hello, my name is Dr. Brian Raid, and I'm a naturopathic doctor, and this is a video about a really great clinical response that I recently had with a patient using something called low-dose immunotherapy, or LDI for short. And I've posted other videos about LDI before. If you go to my YouTube channel, if you're not watching this on YouTube already, on my channel, I posted a video about low-dose immunotherapy many years ago now, and there's a whole 45-minute long presentation about that. If you are watching this on YouTube, by the way, if there was an ad associated with this video, YouTube did not ask me about that ad, nor do I receive any financial compensation for them putting ads on my video. So just FYI, I don't endorse or have anything to do with any products that are advertised if you're watching this on YouTube. So the case in question, so this patient was dealing with a lot of fatigue, a lot of muscle and joint aches and pains, a lot of respiratory issues. They were having a lot of allergy symptoms, a lot of headaches, and just to make a very long story short, they were working with some antimicrobial herbs, using some mitochondrial support, using some N-acetylcysteine to help with the lung function, working with some certain therapies to help, like quercetin, things like that, to help with allergy symptoms. And we were seeing some improvements moving in the right direction, but it was a little bit slow. And after about maybe 4 or 5 months or so, the amount of improvement that we saw just wasn't really happening as quickly as either one of us wanted to see it moving. I'm a bit antsy as a clinician. I'd like my patients to be better yesterday. Patients oftentimes want to be better yesterday, so we see eye to eye on that. So we're both feeling a little bit antsy. And so based on some of the characteristics of the case, I thought that there might be an issue with a microbial hypersensitivity. And so with low-dose immunotherapy, the elevator pitch with that is that it basically involves using formulas that are made up of the antigens, or kind of the proteins or body parts, if you will, of the microbe in question that is possibly causing an issue for the patient. The patient might actually have a sensitivity or kind of like an allergy to that microorganism. And so they basically take the solution of basically the diluted antigens, or body parts, if you will, of the microbe, and then they take that orally, like under their tongue, and then it basically works to help retrain their immune system. It's kind of like the same way that if a person went to an allergist with a dust allergy, they inject them with diluted amounts of dust. So it's kind of like you give a low dose of the thing that's causing the problem, essentially. So it's the same premise with low-dose immunotherapy. So to make it's already a long story now, but only 2 minutes and 45 seconds. But anyways, to get to the punchline, so the patient started on this low-dose immunotherapy formula for the Lyme disease-causing bacteria known as Borrelia burgdorferi, and lo and behold, within the span of a couple of weeks, just dramatic improvement. The patient was, say the patient was at, say, 30% of their optimal health before we started. They were up to maybe 50% after the 5 months. They shot right up to like 80-90%, depending on the day, just with the low-dose immunotherapy. So just a huge, slam dunk as far as I'm concerned with those kind of numbers. So it was really exciting. They were able to, taper off their herbs and taper off other parts of their protocol, and still working on the allergy aspect of things. So there's actually an offshoot of low-dose immunotherapy called low-dose allergen therapy. It's actually the parent therapy of low-dose immunotherapy, and so we're working with that to mop up the allergies and things like that. So I just wanted to share that story because low-dose immunotherapy, it's been in my arsenal of therapeutic interventions for about 8 or 9 years now. I've used it with hundreds and hundreds of patients. We've given out tens of thousands of dosages, and it can be just a really helpful therapy. And oftentimes I will use it earlier in the treatment process, just for various reasons. I didn't with this patient, but especially in those cases where it's like, we know that there's an infectious component, we're doing everything right, we're treating with herbs and this, that, and the other thing, we're supporting the body's other functions. Like, why is this person not getting better faster, or why have they hit a plateau? And sometimes it's because they have an actual sensitivity to the microbe, or the microbe has induced some type of an abnormal immune system reaction in the body that's just perpetuating inflammatory symptoms. There are clues, like very important clinical clues, that can give insight into when low-dose immunotherapy might be applicable. As I'm thinking about it, I think I've posted videos about that before, but I might post another one because it's just such a fun, exciting topic. So I'll leave it there in this case. So low-dose immunotherapy for the win. So happy for this patient, and just love seeing this in practice. It's such a powerful therapy for the patients for whom it's indicated. So I hope this was helpful information. If anybody has any questions or comments, please feel free to please feel free to post them below, and I will leave it there for now.